Hi there, my name is Kevin Moss. I'm a senior editor with Consumers Checkbook. Thanks for joining us today. Today we're going to talk about all that's new in FEHB for next year, plan year 2026. Today, here's our agenda. I'll give you a short background on our organization, Consumers Checkbook. I'll share with you an approach to plan shopping that may help you when you're thinking about choosing a plan for next year. We'll also talk about what's new in 2026 in FEHB. We'll share with you ways to save money. In the era of high premiums, this should be something that everyone is interested in learning about. And then we'll also share a little bit of FEHB and Medicare advice. So the mission of Consumers Checkbook is quite simple. We're dedicated to help providing consumers with unbiased information to help them make difficult decisions easier. We are an independent, nonprofit organization founded in Washington, D.C. We do not accept any advertising in any of our publications or websites. We were founded in 1974, and for 47 years, starting in plan year 1979, we have been publishing Checkbook's Guide to Health Plans for Federal Employees. And it started as a print publication, but now is an online plan comparison tool that dozens of agencies provide access to for their employees, and that individuals can also pay for access. Now, why did we create the Guide to Health Plans? Well, first, choosing a health insurance plan is hard. We have one of the readers that reaches out to me every year. He lives in the Northeast, and he's a retired NASA scientist, and he has told me that rocket science is easier than choosing a health plan. So if you're finding that this is difficult, don't feel bad. It's difficult for everyone. What makes it difficult is that there's multiple FEHB plan types to start with. So we have HMOs, we have PPOs, we have consumer-driven health plans, and we have high deductible health plans. All of them differ a little bit in terms of how much you have to pay upfront in premium and how much you'll pay out of pocket when you use healthcare services. Next, there are dozens of FEHB plans to choose from. The plans that are available to you will be based on your zip code, but most markets will have at least a couple dozen plans that you can choose from. And this is a healthy sign of a market, and through market competition, we hope that we see two things: that the competition drives down premium and it increases quality, but no one person has enough time to go through all of these FEHB plans, and going through 150-page PDFs. So lots of plans to choose from, lots of different plan types, and then a wide range of costs. So in the DC area for self and family premiums, we see the lowest premium plan around $3,800, but the highest premium plan almost $24,000. So wide range of costs, lots of plans in between those two cost extremes. And then finally, when we think about health insurance, we think about a couple different things. What plan is going to take care of the things that I know that I need in any given plan year? And then also, I need a plan that's going to protect me for the things that I can't predict. Nobody knows in their family next year where they're going to have an accident, an unexpected hospitalization, a new disease diagnosis. And so we're looking for a plan that's going to do two things. One, lower our costs and keep our costs manageable for the things that we know about and the things that we can predict, but also take care of us when something happens that's unpredictable. So what we're going to share for you next is kind of a step-by-step approach that you can go through to evaluate your current plan, and sprinkled into this advice will be things that are going to be different next year. All right, so to start off with, we got to talk about what plans are even available. The overall story is that there's fewer plans in FEHB next year compared to this year. So this year we had 146 plans. Next year there's going to be 132 plans. Now let's start with new plans not a lot is new next year. Really only 2 new plans in a couple different areas around the country. Kaiser has added a Prosper plan in their Fresno, California market, and Baylor Scott & White has added a value plan in the 2 Texas markets that they serve. Now there are several plans that are leaving FEHB. Let's start with the local plans or the HMO plans. Centara Health, high deductible and high plan in the Virginia markets are gone next year. Priority Health, high, standard, and value in Michigan. Independent Health still has plans in FEHB, but they no longer will have their high version of the plan next year. Blue Care Network of Michigan, their high version of the plan is still available in certain parts of Michigan, but one of the geographic areas is no longer available. AvMed was a carrier down in Florida. Their plans are gone next year. And Aetna Open Access High is still a plan next year, but in 3 of their markets, it's no longer available in Georgia, Arizona, and Pennsylvania. But the big story is NALC, okay, National Association of Letter Carriers. They are exiting FEHB next year. Now, their plans are still available in PSHB for postal employees and annuitants, but in FEHB, NALC is not going to be available next year. They had 2 plans, a high plan and a consumer-driven health plan. Now this will impact about 28,000 federal employees and annuitants who are losing the NALC plan. Now if you're impacted by this, NALC will have already have sent you a notification that your plan is terminating, and it is very important that you make a positive election this open season into the plan that's the best fit for you. Now OPM will make sure that you don't go without, and they have designated a default enrollment plan, but it's a little unprecedented next year, the plan that they've chosen. Most of the time they choose the lowest cost nationwide plan that's not an HMO and that does not charge membership fee. But next year they have chosen something different, and they are allowed to choose whatever default plan they think best serves the program. Next year that plan is GEHA High. So anyone who's losing their health plan and they don't make a positive election, you will be auto-enrolled into GEHA High. It is a plan that you may want to consider, but there's a lot of other plans too that you may want to consider. And one thing to know about GEHA High, it does have one of the highest premiums of a nationwide PPO plan. So if you've lost your plan, make sure that you're considering all of your choices and make sure that you're making a positive election into the plan that you feel is the best fit for you next year. Now we are in the era of higher premiums. If you haven't heard this story yet, then I am here to share with you some news that you may not enjoy. And that is that the average enrollee share premium is increasing in 2026, another double-digit premium increase. Now it's a little bit less than this year. This year we were at 13.5% on the average enrollee share. Next year it's 12.3%, but you can see that now we have 2 straight years of double-digit premium increases. Now when OPM released information on the 2026 open season, they pointed to a few factors that's driving these premium increases. So first, greater utilization of prescription drugs, specifically the GLP-1 weight loss drugs. Next, they talk about just higher healthcare utilization for lots of different services, and that we're just in a very still in a high inflation era right now. And then they also pointed to the higher average age of the federal worker compared to workers in the private sector. So a combination of more prescription drugs, specifically GLP-1s, greater healthcare utilization across FEHB, a little bit of inflationary factors, and the fact that the age is a little bit higher in the federal workforce, which is increasing utilization of healthcare services. Okay, so an important thing to know about the premium and the average enrollee share increase is that it is an average. It does not mean that all plans move with the same velocity in terms of how their premium is changing. If we look at all the plans that were available this year and next year, we actually see 23 plans where the premium is decreasing. No plan has the same premium next year. 57 plans where the premium is increasing but below that 12.3% average, and then 49 plans where the premium's actually increasing above the average. So you'll want to take note in your plan, which way is the premium moving for you? This is something that will change next year for every single FEHB plan. Every single FEHB plan will have a different premium next year compared to this year. I like going to the very last page of the FEHB plan brochure to see the premiums for your plan. They will show you self plus one, self and family, government share, enrollee share. I like going there to see how the premium is changing. Now, I did pull out two edge cases here to illustrate the types of percentage changes that can happen from one year to the next and the dollar amounts involved. The largest decrease in FEHB next year is in Kaiser Permanente's high plan in the Atlanta, Georgia area. That premium for self-only is going down 18%, and this will save self-only enrollees $727 next year. The largest increase comes from United Healthcare's Choice Plus primary plan in one of the markets it serves. It's almost doubling, 99% higher. This is going to cost self-only enrollees around an extra $2,330 next year. So this is an element that's going to change in your plan. You'll want to know how it's changing so there's no surprises at the beginning of the year. So now that we know that the premiums are going up most of the time, but not always, we may already be thinking to ourselves, are there some other plans that may offer greater value or have lower premiums? And the answer depends, of course, on what plan you're in now, but often there probably will be plans that offer a lower premium. And one way to think about plans that offer more value is how much of the premium does the government actually pay towards the total premium? And it depends on your plan how much that will be. You'll either get 72% of the weighted average for all plans based on your enrollment type, or the government will pay 75% of the total premium of the plan, whichever is less. Now, for about half the plans next year in FEHB, you're going to be receiving a 75% contribution towards the premium. This includes plans like Blue Cross Blue Shield, FEP Blue Focus, GEHA Standard, MHBP Standard, Aetna Advantage, United Healthcare Choice Primary, several Kaiser plans, and others. However, depending upon your plan, the 72% of the weighted average may not be getting you very far. There's a plan in the New Jersey area, Aetna Open Access High, that has such a high premium that 72% of the weighted average only is covering 27% of the premium. The enrollee is actually paying 73% of the premium for that plan. This is one way to find plans that are offering greater value. Understand that there's at least half the plans available in FEHB where the government could be paying 75% of your premium. All right, the next thing that we need to check is benefits. So what you're going to pay next year isn't just the for sure cost of premium, which is going up in most cases, but also what you'll pay out of pocket. And there could be significant changes to what you're paying out of pocket. And the very best place to go to see what's changing next year, you want to go to Section 2 of the official FEHB plan brochure. This is the section that will say changes for 2026. And that will be where the plan outlines all the significant differences in your plan next year. Now, I've pulled out a couple of examples here of some of the things that I've seen that I think are worth noting. In about 29 FEHB plans, there will be a catastrophic limit increase. So this is in the worst cost year, how much you would have to pay out of pocket for covered services. And one of those catastrophic limits, it's worth mentioning, GEHA Standard in their out-of-network catastrophic limit. It is in 1 year moving from 8,500 to 20,000 for a self-only enrollment, and from 17,000 to 40,000 self plus one, self and family. Now this is a 135% increase. If you're using out-of-network providers in that plan, your potential out-of-pocket costs have gone up quite a bit, and I think that's something that you'll want to know. Also, in both GHA Standard and GHA High, the coinsurance percentage is different next year, which means every benefit in those plans that uses a coinsurance will have a different cost to you, the plan member, next year. You'll want to go to the GHA Standard and High plan brochure to see how that is changing. Now, Kaiser, in all of the Kaiser plans, they're changing their out-of-pocket costs for GLP-1 weight loss drugs. Those will now be a 50% coinsurance. And while most of the time the changes that are in Section 2 are a result in higher costs for plan members, sometimes we also learn about new benefits that are being offered. And there's doula coverage, which is a little bit of an expansion of maternity benefits from Anthem, Blue Cross California, Qual Choice, and Kaiser Colorado plans. And then sometimes we see where the out-of-pocket costs could be lower for plan members next year. This doesn't happen often, but it does happen from time to time. And in Pennsylvania, in the markets that Geisinger serves, in their basic plan, the plan deductible is eliminated, and in their standard plan, it is reduced. So the plan that you get next year is going to be different than the plan that you get this year. In all cases, the premium is different, and you could see other differences in the plan with your out-of-pocket costs for benefits. And some of these changes may result in you wanting to think about a new plan. The only way to know what's changing next year is to go to the official FEHB plan brochure. Go to Section 2, see what's changing. Now, one of the positives about benefits changing next year is that next year we'll have a record number of FEHB plans that provide coverage for in vitro fertilization or IVF. And this is because OPM is now saying to FEHB carriers that operate an HMO plan in a state that has an IVF mandate that IVF coverage also needs to be available in the FEHB plan. And the impact of that next year is that more local plans will have IVF coverage. And so Altius plans in Utah, plus several Aetna plans around the country in the markets they serve, United Choice, their open access plus primary and high deductible health plans, Health Net of California, Anthem Blue Cross of California, and then Kaiser of Northern and Southern California. And this is on top of all the other plans that are already providing IVF coverage to federal employees, including 2 nationwide PPO plans, Blue Cross Blue Shield Standard and GEHA High. So if you're a family that's looking for IVF coverage, you've got 2 nationwide PPOs and, depending upon where you live, more local HMO access to IVF in 2026. So one other thing that can change from 1 year to the next that you will want to check on is your access to providers in your FEHB plan and prescription drugs. These can change from one plan year to the next. For providers, they can actually change throughout the year or any time during the year. And in the Mid-Atlantic area, this past year, we saw where United Healthcare and Johns Hopkins fell out of agreement, which meant that Johns Hopkins facilities and providers are now out of network in both United Healthcare FEHB plans and other FEHB plans that use a United Healthcare network. To understand whether or not your provider is still going to be in network, you will have to go to the carrier website, look for the provider search feature, and then you can also call your provider to see if they'll continue accepting your current plan next year. For prescription drugs, a couple things can happen. The drug can fall off the formulary and no longer be covered, or sometimes it can be reclassified into a different drug tier. That can change the out-of-pocket costs of a prescription drug. One great innovation is FEHB is asking the FEHB plans to include prescription drug lookup and pricing tools on their sites where you can put in your medication, the dosage, even what pharmacy you want to get the prescription filled in, and you will get an out-of-pocket price. Highly recommend that if you are taking prescription drugs in your plan, that you are searching during open season to make sure that there aren't any coverage changes, and also your providers, it is worth a little bit of time to make sure that they'll still stay in network. You'll always pay less staying in network in FEHB plans. So, in an era of high premiums, we have to think about ways that we can save money, and let's talk about what those ways are. So the number one way that you'll be able to save money next year is enrolling in a different FEHB plan. Now, a lot of how much savings are available to you does depend on what your current plan is. But knowing that around 70% of all federal employees and annuitants are enrolled in a Blue Cross plan tells us that most federal employees and annuitants do have lower cost plans. Now, one thing that we do at Checkbook, we model plans on yearly cost estimates, and we take the inputs of the users when they're on our plan comparison tool. We find families that are like you. We see what healthcare expenses, typical healthcare expenses, look like for that family. We then take that healthcare utilization and we run it across the benefit structures of all the plans. This produces an actuarial yearly cost estimate that is a benchmark ranking of plans from least to most expensive. Now, on the screen are a sample of a few plans. This is a profile for a family of 4 in the Washington, D.C. area where the age of the primary insured is 50 that expects average healthcare costs. Now, the range of yearly cost estimates for that family is as low as $5,600, as high as almost a little over $17,000. And I've pulled out a few examples strategically, curated this list of plans because there's a story here for each of these plans. First, one of the lowest cost plan types available in many areas, not just in the DC area, will be a local HMO plan. In the Mid-Atlantic area, Kaiser Standard Plan is the lowest cost plan next year for this family profile. It's realizing these savings through a lower plan premium, lower out-of-pocket costs. Now, Kaiser is very unique in terms of how they deliver healthcare. It's a vertically integrated healthcare delivery model where their providers are Kaiser employees and the facilities are Kaiser facilities. So if you're not in a Kaiser plan right now, one of the trade-offs of going into Kaiser will be that you're not going to take your current doctor with you because your current doctor is not a Kaiser doctor or a Kaiser employee. And so you may or may not be willing to make that trade, but if you were able to make that trade, Kaiser does have some of the lowest costs in FEHB in the Mid-Atlantic area. Now, both high deductible health plans and consumer-driven health plans do drive lower costs, and we're going to talk about each of those plan types in a little bit. Okay, we said 70% of all federal employees and annuitants are on a Blue Cross plan, and the two most popular Blue Cross plans are Blue Cross Basic and Blue Cross Standard. For any enrollee in those two plans who are looking for another PPO plan that has lower costs, you may want to look at MHBP Standard, which has a lower premium than both Basic and Standard and similar out-of-pocket costs. There are potentially, depending on your plan, thousands of dollars of savings switching to MHBP Standard. So, one thing that you could think about if you're thinking about switching plans is maybe doing an evaluation of whether or not you're in the right plan from your carrier. Now, it's very common in FEHB to see carriers offering multiple plans. So it's true of GEHA, it's true of United, Kaiser, Aetna. We see that it's very common across the carriers, and what's true is that in most cases you will have the same in-network providers underneath a carrier umbrella. So if you were to switch to a different plan in the same carrier, a lot of times you're not trading access to your in-network providers. Blue Cross is one to talk about both for their market share and because of some of the differences between the plans. Now, Blue Cross Standard is the plan that has the most generous benefits of the 3 Blue Cross plans, and it has some things that are unique to it. And if you're using these unique services within Blue Cross Standard, then you may be in the right Blue Cross plan. But if you aren't using these, note that you could downgrade a little bit into Blue Cross Basic or FEP Blue Focus and save some money. So in Blue Cross Standard, you have out-of-network provider coverage. You have mail order prescription drug coverage. Now, Blue Cross Basic does give you mail order prescription drug coverage once you're enrolled in Medicare Part B or if you take the Part D plan, but not before Medicare comes into play. Blue Cross Standard also has skilled nursing care benefits, and it is one of the 2 nationwide PPO plans outside of GHA High that has IVF coverage. If you're in Blue Cross Standard and you're not utilizing those benefits and you're happy with in-network providers, you could think about switching either to Blue Cross Basic or FEP Blue Focus and save some money next year. Okay, consumer-driven health plans, or CDHP. These are plan types that do produce lower costs. And one of the principal drivers of those lower costs is this plan contribution to a savings account. The savings account in a consumer-driven health plan is a health reimbursement account or an HRA. Now, some plans will brand this as like a personal care account, but for all intents and purposes, it is still a health reimbursement account. Now, how much you get into that account differs by plan and enrollment type. So for self-only enrollees, anywhere from $900 to $1,200, and for self plus one or self and family, anywhere from $1,800 to $2,400. Now, when you're in a consumer-driven health plan, you get the entire amount of that HRA contribution at the beginning of the year. How it works is that when you actually use the health plan, and let's say you go to the doctor for a sick visit, whatever that out-of-pocket expense is deducted from the HRA before you're asked to pay out of pocket. And that will continue like that throughout the year until you exhaust the funds in the HRA, and then if you have other out-of-pocket costs, you would have to pay those yourself. Now, importantly, you cannot contribute any additional funds into the HRA, and the plan owns the account, which means there's no portability. So if you are in a consumer-driven health plan one year and you switch to any other plan the following year, any unused funds in the HRA would be forfeited. And the HRA is only there for qualified healthcare expenses. You can't make any non-medical distributions from an HRA. Now, all unused funds roll over from one year to the next if you stay enrolled in the consumer-driven health plan. But some plans have a ceiling as to how much you can bring over. And generally, it's around $5,000 for self-only enrollments, $10,000 for self plus one or self and family enrollments. It's somewhat difficult for this to come into play or be a factor, given that the plan is going to take from the HRA every time you use a healthcare service. You would have to have several years in a row where you had almost no healthcare costs in order for this ceiling to be a problem. And one other very important thing about the consumer-driven health plan, because you're not making any, and you can't make any voluntary contributions, you are still allowed to keep a general purpose medical flexible spending account. So you can have both of those going at the same time. All right, now let's talk about the high deductible health plans, or an HDHP. There are some things that are going on here that are more interesting than the consumer-driven health plan, and it really has to do with the savings account you get and what you can do with that savings account. So with the high deductible health plan, the HDHP, you get what's called a health savings account, or an HSA. Now, how the HSA works, it's the same. It's very similar to the amount of money that a consumer-driven health plan would give into an HRA. It depends on the plan, but anywhere from $750 to $1,200 self-only, $1,500 to $2,400 self plus one or self and family. But instead of getting all of the money at the beginning of the year, like what happens with the consumer-driven health plan, you get this money every month as a monthly premium pass-through. So if you were in a high deductible health plan and you were self-only and the plan said they'll give you $1,200, you'd get $100 every month throughout the year to make the $1,200. Now, you are able to put in your own voluntary contributions into an HSA, and the limits are increasing a little bit for 2026. They're going up to $4,400 self-only, $8,750 for self plus one or self and family. And depending on your age, you may be able to contribute more. If you're at least 55 or older, you qualify for a $1,000 catch-up contribution. Now, importantly, you as the plan member own the account in a high deductible health plan, which means that it's fully portable. So that HSA is with you for as long as you want it to be, or as long as it's viable, or as long as it has funds. So you could be in a high deductible health plan with an HSA, let's say for 5 years, and have, let's say $10,000 in your HSA, and then you decide that you want to go to a PPO plan. You keep that HSA and the funds that are already in it, even after you switch to a different plan. And the HSA has more flexibility than the HRA because you can make a non-medical distribution, but do realize that that will be a taxable event before the age of 65. In addition to your normal tax obligations, you would also be subject to a 20% penalty for a non-medical distribution. However, after you turn 65, the penalty goes away and you just pay regular taxes. So in many ways, you can think about the HSA almost converting to a traditional IRA once you turn 65. Always there for you to withdraw funds for qualified healthcare expenses, but also the flexibility for non-medical, and you would just pay your regular taxes. So HSAs do allow you to make voluntary contributions, and any voluntary contribution you make is triple tax advantaged. It's going to go into the HSA tax-free, either as a payroll deduction or as a lump sum that you can later claim on your taxes. It's going to grow tax-free. So each high deductible health plan chooses a financial service company where you will be able, if you want, to invest your HSA funds into a range of investment choices. So depending upon how conservative or aggressive your investment strategy is, and any growth or returns from those investments are tax-free, and those for any qualified healthcare expense, your funds out of your HSA leave the HSA tax-free. So triple tax advantaged. Now, a couple different strategies if you want to try to maximize your HSA. One is for dental and vision expenses, you can set up a limited expense flexible spending account or a LEX FSA. Now, with the high deductible and HSA, you cannot get that general purpose medical FSA, but you can get the limited expense for dental and vision. And it's worth considering because you'll get the same tax benefit going in that FSA, in that you can do a payroll deduction into the FSA. It lowers your taxable income, and anything that you pay out of the FSA produces somewhere around a 30% discount. And the reason to consider doing this when you have the HSA is that you can now use the FSA, the limited FSA, for your dental and vision. Still enjoy the same tax benefits of how to pay for those expenses, but keeping your HSA funds invested and growing over time. The other thing to consider is many people, when they go into a high deductible health plan, are coming from a more expensive PPO plan. And there's a little bit of premium savings there for you when you switch to the high deductible health plan. And instead of pocketing that as a little bit of a pay bump, take that delta, the spread of premium there, and instead put that into the HSA as a voluntary contribution. You've already been budgeting of paying that higher premium. You can just take that premium difference, put that in as a voluntary contribution, and then draw from that for any of your out-of-pocket healthcare costs, and try to leave what the plan puts into your HSA alone, growing over time. Now, the HSA will be a low-cost plan choice for many people, but it may not be the right choice for everyone, and there's probably a little bit more risk of higher out-of-pocket costs in a high deductible health plan with an HSA compared to other types of plans. If you were unlucky and you had a major event at the beginning of the year, you would probably have to pay the entire deductible plus a coinsurance of anything on top of that, and not have any of all of the contributions into your HSA available to you, since you're only getting those on a monthly basis. And that's a lot more out-of-pocket costs than what you would see in other PPO plans that either have very low deductibles or no deductibles and a smaller fixed copay for something like outpatient hospital. So you will have to sort of measure and do the trade-offs there of that type of risk versus all of the other benefits that a high deductible health plan with an HSA offers. Guaranteed way to save money is a flexible spending account, only available if you're an active employee. Once you're an annuitant and paid via an annuity, you can no longer participate in the flexible spending account. Now, this is an easy way to save about 30% on all of your out-of-pocket healthcare costs. You decide how much money is going to go into the FSA, and every 2 weeks or biweekly, that amount then is deducted from your take-home pay before taxes, and everything that you pay out of the FSA, you get about a 30% savings on those out-of-pocket healthcare costs. Now, all federal employees should have this, but sadly only about 20% of federal employees do, but it really should be 100. And that's because I think all federal employees have some amount of predictable out-of-pocket healthcare costs. So when we think about medical appointments, if we think about prescription drugs, if we think about other known healthcare use we're going to have in a year, if we start adding in things like dental care, vision care, and if we start considering many over-the-counter pharmacy items that are FSA eligible, I think almost all federal employees can put together $500 or more that they could be putting into the FSA and saving 30% on their out-of-pocket healthcare costs. Now, if you're in a consumer-driven health plan or an HMO or a PPO, you can get the general healthcare FSA. If you're in the high deductible health plan, it's only the limited expense FSA for dental and vision. Now, there is a limit in terms of how much you can put in, and this is the aspect of the FSA that people don't like. There is this use or lose principle. The limit is $3,400 next year in the FSA. And the use or lose is if you decided to put in that full $3,400 and you only had $1,000 of qualified healthcare expenses, you can only roll over $680 next year of those unused funds. So you definitely don't want to take out more than what you think that you're going to use. But there is a no-risk strategy here of how to never lose money in an FSA, and that is this. If you don't currently have the FSA and you don't know how it'll work or if it will benefit you, don't put in more than $680. Why don't you just put in $680 to start off with? In a perfect year where you had zero healthcare costs, as long as you stay enrolled in the FSA program, you would be able to roll over that entire $680 into the next plan year. Now, FSA open season matches FEHB open season. It runs through December 8th. You go to fsafeds.gov. And again, this is a program and a benefit that's only available to active employees. There may be some administrative burden in terms of dealing with claims, and maybe that's a reason why not more than 20% of federal employees have one. But if you haven't looked at this recently, there's now paperless reimbursement where a lot of the times you don't even have to bring in your claims or your receipts. A lot of that's happening automatically between your provider and the FSA administrator. So do consider this if you're looking for ways to save money. This is actually a guaranteed way to save money on your healthcare costs next year. All right, two-person families. These are either defined as a married couple or it could be an adult with a dependent child. You have an option in terms of how you enroll in an FEHB plan. You can either enroll as self plus one or self and family. Now, majority of the time, self plus one is going to be least expensive. However, next year, there are 39 FEHB plans where self and family is less expensive than self plus one. Let's look at one. It's Kaiser High in the DC area. The biweekly self plus one premium is $367.58 next year. The biweekly self and family premium is $300.72. This is a difference of almost $67 biweekly, and that amounts to $1,738 a year that you could either save or overpay based on how you enroll. Regardless of how you enroll, you will receive the same plan and the same benefits. The only thing that's different is the premium that you're paying, and you'll always want to choose the one that's less. The best place to go to find out this answer is the last page of any FEHB plan brochure. It will show you self, self plus one, self and family, and look for enrollee share, and look between self plus one and self and family and see if it's less expensive to enroll as self and family versus self plus one. All right, supplemental benefits. Many FEHB plans do offer supplemental benefits. You can find out about these supplemental benefits in plan marketing materials, the carrier website, also in the official FEHB plan brochure. If you go to the very end of section 5, they often talk about wellness benefits or non-FEHB plan benefits. And what are the types of things that you can find? Free or discounted gym memberships, vision care, LASIK care, dental and hearing aid discounts, and healthy rewards. This could be your plan paying you for doing the things that you're already doing, such as getting an annual physical or a flu shot or an online health assessment or current barometric readings or findings. And so if plans do provide these benefits, they generally are paying you anywhere from like $50, $75, some plans even more than that. By doing those activities, the plan pays you in a prepaid flexible spending card that you can use for any out-of-pocket healthcare costs. So this is something that's there that maybe you're not taking advantage of. I probably wouldn't recommend someone enrolling in a plan just in the presence of one of these, but it could be something that you are paying out of pocket for right now that your plan may help you with, and this could be a way to save a little bit of money next year. It only gets more difficult for annuitants. Not only do they have to think about which FEHB plan is the right choice for them, they also have to consider their Medicare choice and how Medicare works with FEHB. Let's talk about how all the ways that FEHB and Medicare will be a little bit different next year. All right, so let's start with Medicare and the things that are different in Medicare and some of the impacts in the FEHB program. I think the first thing to say is almost another double-digit premium increase annuitants with Part B will face next year. So the Part B premium, it's not quite double digits, it's like 9.8% or so, but the Part B premium is moving from $185 a month in 2025 to $202.90 for 2026. Now, what you pay for the Medicare Part B premium is determined by your income, specifically your modified adjusted gross income, or your MAGI, and there's a 2-year look back. So your 2026 Part B premium is based upon the 2024 modified adjusted gross income from your tax return. Now, the threshold for Part B IRMA is increasing, the income threshold. If you're an individual tax filer your income now has to be $109,000 or greater. If you're a joint tax filer, IRMA kicks in if your income is greater than or equal to $218,000. Now, not only are the Part B premium going up, the income threshold for IRMA, but also the IRMA surcharge is going up a little bit as well. For those that are just in the first tier of Part B IRMA, we're moving from $74 a month in the IRMA surcharge up to $81.20 a month. Besides Medicare Part B, IRMA also applies with Medicare Part D, as in drug. And that IRMA surcharge is also going up a little bit, not much, less than $1. It's in the first income tier, $13.70 a month in 25, and it's moving to $14.50 a month in 2026. Now, this year was the first year that all Medicare Part D plans offered a $2,000 out-of-pocket catastrophic limit from all Part D plans from covered drugs within that Part D plan. Now, that limit's going up next year a little bit to $2,100. All of the Part D, all of the FEHB plans that offer Part D are still offering them in 2026, except for Blue Cross FEP Blue Focus. They are eliminating Part D coverage in their plan. If you have Blue Cross Blue Shield FEP Blue Focus and you want to keep Part D coverage, you will need to switch to another FEHB plan. There's also a few new plans that have added Medicare Part D. Kaiser in their Washington core market has added Part D in their High, Standard, and Prosper for those enrollees who have Medicare but aren't in the Medicare Advantage plan. And then Kaiser Fresno has added a Medicare Advantage plan for one of their plans. So one of the number one questions that I get is, should I enroll in Medicare Part B? And the answer is, it depends. And one of the things that it's grounded upon is, are you going to get some benefit from enrolling in Medicare Part B from the plan that you're enrolled in? This is called Medicare coordination or wraparound benefits, but the basic idea of it is that when you enroll in Medicare, Medicare becomes primary, your FEHB plan becomes secondary, and in many FEHB plans, but not all, your out-of-pocket costs for Part A and Part B services will go to zero. So the first thing about sort of thinking about Medicare Part B is, if you're going to pay the premium, you want to get something for it. One of the things that you're going to get for it is zero out-of-pocket costs. So where to go to see how your plan works with Medicare is Section 9 of the official FEHB plan brochure. That will be the place where the plan says, here's how it works when Medicare is primary. Now, I've pulled out a couple of different examples here to show you the types of things that you can see. The first is GHA Elevate. And in very bold black letters, they say, for members enrolled in the Elevate option, we don't waive deductibles, coinsurance, or co-payments for Medicare members. So this is a plan that we would say does not coordinate with Medicare, because you're still going to be subject to all of the out-of-pocket costs you had before you had Medicare. And if you had this plan, which may have been a plan that worked great for you while you were an active employee, it definitely doesn't work great for you if you decide to enroll in Medicare. And you may want to think about another plan. And there's not just GEHA Elevate Plus that will do something for you when you have Medicare. There's lots of other FEHB plans too that will eliminate your costs when Medicare is primary. If we look at GHA Elevate Plus, though, this is the type of thing that we're looking for where we're getting a benefit from having Medicare Part B. So Elevate Plus says that they do waive some costs. And if you have Part A, they're waiving inpatient hospital. And if you have Part B, they're waiving outpatient facility and physician costs in many different locations. And so this is what we're looking for, right? Zero out of pocket for Part A and Part B services in Elevate Plus. So this would be a plan that we said does work well with Medicare. There are a handful of plans, not many, that offer partial Part B premium reimbursement as well per Medicare beneficiary. So if there's one of you in Blue Cross Basic, you would get $800 a year, but if there's two Medicare beneficiaries paying two Part B premiums, the $800 from Blue Cross Basic goes to $1,600. A GEHA high is $1,000 a year per Medicare beneficiary. So to think about whether to have Medicare Part B or not, you want to think, are there benefits of me getting Part B in terms of lower out-of-pocket costs? With Part B, I can go outside of my plan's provider network, see any provider that accepts Medicare. If I do so, I may have to pay the Part B deductible or the 20% cost of service. And the final is, with Part B, you can enroll in Medicare Advantage plans, and Medicare Advantage plans are often leading to the lowest out-of-pocket costs for federal annuitants. All right, Medicare Advantage is going to be the least costly plan choice for many federal annuitants. Depending upon where you live, there will be different plans available to you, but there's around 40 plans offered by FEHB carriers next year. There are national plans offered by GEHA High and Standard, MHBP Standard, APWU High, Foreign Service, Samba High and Standard, Compass Rose High, and Aetna Advantage. And depending on where you live, you may find local plans from United Healthcare, Kaiser, MDIPA, Health Alliance HMO, Health Net of California, and UPMC Standard. Now, what's driving these lower costs in Medicare Advantage plans? I think there's really three principal drivers that are making these plans least costly for federal annuitants. One, many of the plans that are offering the Medicare Advantage plan charge a lower FEHB plan premium compared to some of the other plans out there in FEHB. Now, none of the Medicare Advantage plans charge an additional premium. However, you keep paying both FEHB and Part B premium, and because the Medicare Advantage plans are packaging Medicare Part D, if you're subject to IRMAA, you would have to pay both Part B and Part D IRMAA. But another factor that's producing lower costs is just greater Part B premium reimbursement. So even if you're subject to IRMAA, you're going to be getting some of that Part B premium back. How much is in these MA plans does vary by plan. In Aetna Advantage, it's $100 a month. And again, this is per Medicare beneficiary. So if there's two Medicare beneficiaries, then the $100 a month in Aetna Advantage goes to $200 a month. United Healthcare, their Choice Retiree Advantage product, it is $150 a month. GHA High is $100 a month. GHA Standard is $75 a month. And in some Kaiser plans, it can go all the way up to $250, and that's more than the Part B premium. This is to help individuals that pay more for Part B because of either IRMAA, the income-related monthly adjustment amount, or because of a Part B late enrollment penalty. Now, in that Kaiser plan, you typically aren't getting another thing that's driving lower costs, which is zero out-of-pocket costs for approved healthcare services from providers that accept the plan in Medicare. I think the Kaiser plan that gives you that very generous Part B premium reimbursement still has a little out-of-pocket cost when you go to the doctor or if you need to go to the hospital. But many of these plans like Aetna, the GEHA plans, and the United Healthcare plans, for all your major healthcare costs, doctor, imaging, diagnostic, hospital, inpatient, outpatient, it will be zero from providers that accept both the plan and Medicare. Now, before thinking about a Medicare Advantage plan, you are going to need to check your providers. See if there's differences in your providers that you'll have access to. One of your major out-of-pocket costs that are left in these Medicare Advantage plans will be prescription drug coverage. This will be an out-of-pocket cost. You're going to want to have to think about what's covered and how much you'll pay out of pocket for prescription drugs. And then the final is there more prior authorization in the Medicare Advantage plan compared to your FEHB plan? The Medicare Advantage plan documents will talk about a little bit about your prior authorization steps in Medicare Advantage, and if you have any questions, you can reach out to the Medicare Advantage plan directly. All right, Medicare Part D, this is a rather new thing that's in FEHB. We're now in the third year where some FEHB plans are providing Medicare Part D coverage. The plans that are providing Medicare Part D in their plans for next year include Blue Cross Blue Shield, Standard and Basic, and FEP Blue Focus is no longer providing Part D next year in 2026. GEHA High and Standard, MHBP Standard Value Consumer Option, APWU High, Compass Rose High, Foreign Service, Samba High and Standard, Health Partners High and Standard, Aetna Direct, the consumer-driven health plan or the consumer option, Aetna Open Access in the Mid-Atlantic market for High and Basic, Kaiser Washington Core in their High, Standard, and Prosper plans. Now, in order to be approved by OPM to provide Part D coverage, the coverage must be as good or better than the prescription drug coverage from the FEHB plan. That means the same drugs that are available in the FEHB plan must be in the Part D plan, and no worse out of pocket, meaning worst case scenario, your out of pocket costs will be the same, and it could be possibly better. Next year in 2026, there's also a $2,100 out-of-pocket max for most of the Part D plans. And so the carriers that are offering these Part D plans, they are allowed to auto-enroll their Medicare beneficiaries. If you've been auto-enrolled, your FEHB plan will notify you well before the start of open season. They'll tell you that you've been auto-enrolled, and they'll also give you the option to disenroll if you want, and they will tell you how to do so. Now, this is if you've never disenrolled in the past. If you've disenrolled in the past, your plan should not try to auto-enroll you in the future. But if you do have any questions about your status with Medicare Part B, you will need to reach out to your FEHB plan. So for Part D coverage, remember OPM has said it must be equal to or better. One way to determine equal to or better is going to the carrier website and using their prescription drug cost tool. The Blue Cross Blue Shield prescription drug cost tool allows you to enter your medication, your dosage, the pharmacy you want to get it filled, and you can see in one view how much you pay with your regular FEHB drug coverage and how much you pay if you have Medicare Part D. One thing that's unique about FEHB that is not true in commercial Medicare Advantage is that as of right now, you could still get GLP-1 weight loss drugs paid for or covered through your FEHB Part D plan. Now, this is something right now that commercial Medicare Advantage and commercial Part D plans still don't provide access for GLP-1 drugs prescribed for weight loss. You have to have an underlying condition like heart disease or diabetes. Now, this may be changing very soon. It's possible that at the beginning of 26, this will be available in Medicare Part D in the commercial market, but it's true right now, and it has been true in FEHB the last couple of years. So what I wanted to show you here is two things. One, that with Part D, you keep the same drug for one of these GLP-1 drugs, which is Wegovy, and the equal to or better in this particular case is driving much lower out-of-pocket costs. You can see here for Wegovy, if you just had the FEHB prescription drug coverage from Blue Cross Blue Shield Standard, you'd be paying around $607. That goes down to $35 with Part D. And Basic, you would be at around $728. That's going down to $45. This is dramatic savings that Part D is providing for this drug. You may or may not see any savings or any savings that rival these savings for your medications, but do understand that the equal to or better could be giving you a couple of things that your FEHB prescription drug coverage isn't giving you. It could be giving you lower costs, and it's giving you the $2,100 out-of-pocket catastrophic limit protection for any covered prescription drugs. That's why I think for most federal annuitants, Medicare Part D is going to be something that they want. but there are a couple of scenarios where Medicare Part D may not be the right choice for you. If you are subject to IRMA, the income-related monthly adjustment amounts, and you don't have any prescription drug needs, you can disenroll from Medicare Part D because you're not really using it, you're not getting any benefit, and during any future open season, you can come back into Medicare Part D. You'll never be subject to any Part D late enrollment penalty because your prescription drug coverage from your FEHB plan is considered credible drug coverage. If you live overseas, Medicare Part D does not reimburse or pay for drugs purchased overseas. You will not want Medicare Part D. And then finally, as pharmaceutical discount coupons, you can't use a Medicare Part D plan and a pharmaceutical discount coupon together. So you lose the ability to use both of them together. You can, if you want, use a pharmaceutical discount coupon, but you would use it on its own. That means that you would pay an out-of-pocket cost yourself for that, and whatever you do outside of your plan, of course, is not going to contribute to either the Part D catastrophic limit or your FEHB plan's catastrophic limit if you decided to do that. That's what I wanted to share with you today. Thanks for watching this. Many federal agencies are providing free access to our Guide to Health Plans. Go to guidetohealthplans.org to see if your agency provides free access. Both me and my team love helping people who get stuck. So if you do have something that you don't understand, we'll try to help you with that. Send us an email at guidetohealthplans@checkbook.org. And then make sure that you're following us at Checkbook Health on YouTube. You can always watch our latest FEHB advice, and all of this advice is out there for free. I wish everyone a happy and healthy rest of the year and an amazing 2026. Thanks for being with us today. Smash that subscribe button and follow us at Checkbook Health for our latest advice.